Dr. Shonkoff, I have one question that I might start with, if I may. And here it's posed this way. So there seems to be a persistent split between the early childhood community and the school-age community. But if we think like developmental scientists, that split would go away, and we would all understand the path to high school graduation, for example, begins prenatally. Have you seen creative ways to address the artificial split in other states?
No.
Can you tell me a little bit more about that?
Well, you know, I think this is one of the huge challenges and disconnects because, I mean, our policies and our programs are organized by silos of parts of development and health, and also by age. You know, I mean, I think what's most unfortunate is that when we started public education in this country in the 19th century, you know, people arbitrarily picked age 6 as the time to start because they didn't know any better. And even the rhetoric that still continues about, I mean, one of the phrases I dislike quite a bit is this issue of having, trying to get children to the point where they're entering school ready to learn. I like ready to succeed, but ready to learn. Children are ready to learn when they're born. I mean, it's like we beat it out of some of them, but they're all ready to learn. Children don't have to be made to be ready to learn. So I think the reality is that I haven't seen any state that's broken that down. And what's even more troubling about this is that even within age ranges, and everybody knows this, the early childhood field is famous for this. Whether times are tight or whether times are flush, you know, we circle the wagons and shoot at each other and fight over money. Mm-hmm. And so, and I know you have a variation on this challenge in North Carolina right now in terms of how Smart Start and is it more at 4? Did I get that right? Are going to be related to each other. I think what the science is a very clear message for that, is that all of these systems and all of these ages are all operating from the same science base. There is not a separate science base for a birth to 5 agenda compared to a science base for a preschool agenda. There's a different political agenda, but there is no difference in the science. So if we really want to do well for kids, and particularly the ones who need it the most, and do well for ourselves, then what we'll do is we'll just kind of feed off this one science base and ask different questions. Say, how do we optimize the environment of relationships kids grow up into? And how do we optimize learning opportunities? Not how much money should we give to this and how much money do we give that. I mean, no, in the end, that's what you have to decide. But until you make that last decision, the issue should be how is each of them kind of feeding in a synergistic way to this. And the reason I said no is because, you know, I mean, the rigidity of, you know, kind of the way we organize things in bureaucracies is our biggest burden here. And I have no patience anymore for people who say that their mission is to start to get agencies to talk to each other. I would like to see that, but we've been talking about that for a long time. I think this is where leadership at the top makes a big difference. We've seen some big breakthroughs where leadership at the top kind of makes things happen, rather than expecting the bureaucracies themselves to give up their turf. That's the best I could offer.
Great. Well, thank you. Let me actually follow up on that concept. So how do we really best sell the science of early childhood development to the public and promote real change in thinking about the childhood development continuum? What's the best framework that can really make that shift?
I may fall into a trap here because I feel so comfortable here, and I feel such a kinship with North Carolina that I may be more honest than I should be.
Please be.
What the heck? I mean, right? So here's where I think the big problem is. I think we have a science base that's been, you know, reasonably well articulated now that answers the why question about early childhood, you know, rock solid, unequivocally. And the proof is that there isn't a state left in the country that isn't trying to figure out what to do about early childhood. And 5 years ago, there were lots of states where you couldn't even get that conversation started. I think where we have a problem is not with the why question, but the what question and the how question. You know, what comes from what do we know about what's been done everywhere, and how do we do it here? And this is where I'm going to say maybe this is not a smart thing for me to say publicly, but I'm going to say it anyway, because it's a challenge, I think, to my my biggest friends in the audience. I think one of the things that's missing is for us to somehow figure out how to make the environment politically safe. I think we couldn't have done that not too long ago, but I think we could do it now. Make it politically safe to be honest about what we can accomplish with the programs we have and what we can't. And take what we can't and say the answer is, therefore, we have to have some new things to do, we have to have some new ideas. And take the model from the healthcare system that basically doesn't settle for just making people better or just making people able to cope with their problems, but figures out how to prevent them and how to solve them and how to treat them. And so part of the resistance, I think, is that sometimes we have oversold the bill of goods, and it's in nobody's interest. The best programs we have are not going to end intergenerational poverty. They're not going to end high school dropouts. They're not going to end economic underproductivity. But the best things we have could certainly make things a lot better. And let's be realistic about what we can do. Let's stop investing in programs that we know are not having much impact and start investing more in programs that have the best impact we have right now and not settle for them as an endpoint, but settle for them as a starting point. And I'm feeling increasingly comfortable saying this publicly because I think it has to be said. And nobody knows that more than the people who work in the field. I am in no way saying that we are not making a difference. What I'm saying is that we should want better, and we should create a political environment that makes it possible to make things better. The political environment provides incentives for nothing other than finding data to show that what you're doing is working so you can stay in business. That is not good for the field.
Great. I love truth-telling. We're going to get in one more question, and know that we're collecting your questions. We have another Q&A session, but we have time for just one more before we hear from other speakers. Dr. Shonkoff, if you could speak just a little bit more, and actually we just have about 2-3 minutes, about the connection to children's mental health, social emotional health. What is an early care system that would help that? How can we be creative about addressing those needs?
Thank you. That's a great question. I'm firmly opposed to the creation of an early childhood mental health system. It's just never going to happen. What we need is to integrate mental health expertise into the systems we have. And I'll give 2 examples. One is, I'm proud to say, but it's kind of a long way to go. Our lowest hanging fruit in Neurons to Neighborhoods, when we got to that point in the process where one of the answers was we need better integration and less fragmentation. We were embarrassed to say we need better integration and less fragmentation. So we picked out the child welfare system, the child protective service system, and its disconnect from the Part C early intervention system as something that was totally unacceptable given what we know right now. So for starters, I think there were 2 ways we could address serious mental health problems in young children. One is without creating new bureaucracies. Follow what the federal law is right now that no one's implemented because no money was given to do it and because it's hard, is that every child under the age of 3 right now who comes in to Children's Protective Services as a new case ought to automatically be referred to the Part C system for an evaluation. And what we'll find is that most of those kids will be eligible for Part C services. And this is a child find issue for Part C. In the absence of that, we've got a lot of kids in foster care and in child protective services getting nothing except occasional physical examinations to make sure they haven't another broken bone. That's crazy. I think the early care and education system, however you want to define it, is where all the mental health needs are. That's where the kids are. And it doesn't have the expertise that it needs. It doesn't have the training for the staff. It doesn't have access to people who have the training. And one of the endpoints of that is this issue of kids being expelled from early childhood programs because the staff can't manage them. Well, what kind of crazy thing is that? To say that here the kids couldn't be crying out for help more than just saying, I am impossible to deal with in this situation. So our policy response right now is to say, well, since we're not mandated to provide services, get them out. They're ruining it for everybody else. Those are 2 low-hanging fruits, I would say. How to provide the expertise and support in the basic early care and education system, and how to link child welfare, child protective services, to Part C. we could move mountains in terms of advancing what we're doing about mental health there without creating a new program. And the last thing I throw in is that in state-of-the-art treatment of adults with depression, it is unconscionable that a woman can get treated for depression in our healthcare system, and it isn't standard practice to find out whether she has young children and what's being done for the impact of her illness. That should be a part, that should go with the prescription for the antidepressant on the checklist. It's ridiculous, given what we know about the impact of maternal depression on kids, that people who treat adults with depression don't know that. So I don't think the answer is new systems. I think the answer is getting what we know into the systems we have, which
Great.
in the long run doesn't cost that much money, relatively speaking.
Let's thank Dr. Shonkoff.